Welcome to the Life of Being podcast, where we talk about all things life from a healthcare perspective all around the world. I'm your host, Kelly Tan, and in each episode, we'll explore stories, science, and wisdom to help you live well, think deeper, and express life fully. Let's begin. Welcome to the Life of Being podcast. Today's a super special episode. It's our very first on-site podcast conversation, and here we are at Mind Your Spine Family Chiropractic at Rimbayu with Angelina and Tao Yang.
Thanks for having us.
Shall we start by you sharing your story in terms of how you got into chiropractic, experience in the UK, and also coming back to setting up your own practice?
Okay, you go first.
Yep, so I'll start with a little self-introduction. Just call me Tao Yang, will do. So, studied chiropractic in 2016 it was. And then we did 2.5 years in IMU, Malaysia. And then the last final 2 years in USW, UK. So, and then after that, we worked in UK, London specifically, for about 5 years. For me, how I got into chiropractic was an interesting story. So, I always knew that I liked human biology. So, I knew it's going to be a healthcare related because when I was in high school I was a first aider, so shout out to St. John Ambulance Malaysia. I had a passion to help others. I knew that healthcare is the industry that I wanted to be in. So at that time I was chiropractic was pretty much non-existent, at least in my world. It was so new that no one knew what was chiropractic. Even I didn't know what was chiropractic. I thought that, okay, so I was looking at options like, okay, pharmacy, you're gonna look at drugs all day. Probably the one that dentistry, I don't stare into mouths all day long. Probably not. And then, probably medicine might be the only option I have left. The story was interesting that I was actually, so I went to IMU and it was an open day to actually wanted to ask more about medicine actually. And just so happened that we passed by a corner where the chiropractic, faculty was having a free spinal screening. So I was with my parents and then they're like, I didn't want to go to the free spinal screening. I was like, it's just, I don't know, marketing, or I just want to go to upstairs and check out medicine. You know? And my parents were like, it's free, come on, let's go and do it. And at the end, I was just standing there. I didn't even, get checked myself. My parents did. And then my parents were talking to some of the seniors, speak about chiropractic program. And then they were like, this is blah, 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 blah. And then we're like, I didn't even know what is chiropractic. And my parents were like, it sounds good. It sounds like a great, very similar to what you wanted, helping people, healthcare related, seeing patients. At the same time, also the opportunity is still pretty good, pretty high demand for that time because medicine was already pretty saturated at that time. Yes. Even my GP actually didn't encourage me to pursue medicine. He was like, too many medical grads, really think twice before you actually, study medicine. So speaking to the seniors, and also speaking about business opportunities after graduating. And we thought, this is a great option. And so we went back and did some research and then that's the rest was history. So I didn't know what I got myself into at all. Only thing I searched online chiropractic was about pushing someone's spine and then you hear a crack. That's all. I knew I got into that for that reason. And turns out so much more than that. In chiropractic, the world is massive and plenty of potential in terms of how we can help patients. So I don't regret a single bit. I have to say that. Yeah, so that's how I got into chiropractic school, at least. Yes. And how about you, Angelina?
Hi, so I'm Angelina. So for me, it's actually similar but simplified. Okay. So for me, so I always wanted to go, of course, more interested in human biology. So I particularly interested in like bones, muscles, that sort of thing. And I know that I don't really into medicine. So the option for me last time is either, I think it's, what is that called? Physiotherapy. And then when I went to educational fair, that's one time I went there and then I came across this chiropractic course. And I saw the brochure, I was like, okay, this is quite interesting because that's what I wanted to do.
Yes.
Because physiotherapy is more muscle based, but I want to seek something is more skeletal based at that point. So that's how I get into chiropractic and until now.
When Tao Yang was saying that Because when we initially go into chiropractic, we didn't know what it is. So out of your many years of experience learning chiropractic, seeing people, helping people, what is the thing that you've learned now that you didn't knew then and that you wish you knew earlier?
So for me wise, I think I didn't know last time is I didn't know that there's so many techniques in chiropractic itself.
Yes.
And I think at that time is chiropractic is more about adjustments. Like, if you go, get into the joint, you hurt a crack, and that's it. That's what you do.
Okay.
Yeah. But now, I think at the moment, it's more like what the body needs. Yeah. So, sometimes it's not like when you need to wait for the crack, only that's what the body needs. Sometimes, probably you need to let the body go at that day. Sometimes it's not, crack is not everything. Okay. Yeah. And we don't seek for that crack. Yeah. That's what I can see the difference in between before and now. Yeah.
Yep, thanks. So I think the biggest difference I have, I would say, the understanding of chiropractic back then and now is that chiropractic is not just a therapy, a treatment, I would say. It is more a lifestyle and a perspective on how you look at the human body and how you look at natural healing in general, I would say. Because at the end of the day, it's people seek it as a therapy, that I understand, but it changes my perspective on how I look at human body in general, my body and my lifestyle in general. So a great example would be how if I, for example, would feel that my immune system is on the lower side, start to develop sore throat, for example, flu, be it anything. I used to, family culture and, I don't know, Asian culture in general. No offense. My mom would literally open a cupboard full of leftover drugs from GP from, I don't know, a few months ago that I saw him. And then, this is just for sore throat. Take this. Okay, I happily take it for most of my life. Until I started, towards the end of my chiropractic school, I only started realizing that actually how we approach the human body is to, I would say, symptoms-wise, so whatever we feel or symptoms that arises are actually signs that the body is trying to communicate with us. So the fact that you're unwell is that your body is lacking something or you need something that you're not giving to the body. For me, most of the time, if I don't get enough sleep, I'll get that. Not get enough water or very terrible diet. So my perspective shifted to when I feel unwell, I give my body enough rest, enough water, and actually watch out what I eat. And of course, if I have time, exercise if possible. This is how my body actually heals. And since then, I don't think I've taken any antibiotics for, God knows, 5-6 years at least since I graduated, and I feel much better. As in, I don't think I've ever needed to actually get any pain relief or medication from any illnesses for the past 5 years. Just the fact that my body is developing its own immunity, and I learned how to listen to my body and give what the body needs instead of just continue my terrible lifestyle and just taking drugs. That's what I think chiropractic in general is to me, myself. It is how I view myself as learning to live with my body as an experience, but also educating patients about how to actually look at your body, basically.
So you touch upon like natural healing. Do you think that is like more awareness in the recent years, or you feel like maybe in Malaysia, Asian culture is a little bit more lagging behind? Because that's what even my family does. Like, okay, you need this, but your body's not lacking in painkillers, isn't it? So do you think that it's something that we are starting to delve deeper? Is there any message you feel like everyone knows about this, that people will change in terms of how they approach health?
Yes, I would say yes, there definitely is a trend of complementary and more alternative and natural healing. People are seeking, more and more people are trying to seek healthier lifestyle. So you can see the surge of like healthier diets, restaurants, exercises like Pilates, sports, pickleball, everything is booming, mushrooming, and it shows that people actually does gravitate towards healthier lifestyle and natural healing. And I think through many years of people with their experience, actually people would start to question actually why am I on, for example, such medication for forever? Why am I always sick? every few months. Is there anything that I can do? I think people are starting to realize. I think that is why even chiropractic as a profession there's more and more demand for sure. In general, I would say in my experience, yes, most of my patients in London, they are definitely a bit more health conscious. They would sacrifice some of their valuable time for exercising, for example. Actually, take an extra step to change their diet. And it's a bit more difficult, I would say, for Malaysia. Even I find it more difficult when I'm here. Food is too good. Yes. Right, food is too good. We can't deny that.
Malaysian food.
Yes, Malaysian food is too good, but they are good for there are reasons, because they are, most of them, much more oily, high salt, high sugar, of course. And I remember how my patients would always ask me like, "Oh, your food is so good," and I say, and then they always have a how do you say, like a stigma that, oh, Asians must be healthy. You guys are healthy. You guys have sunshine. They how they enjoy having sunshine, and they're like, oh, you guys have sunshine all year long. You guys must have so good lifestyle. Go and sunbathe all day. It's like, no, not at all, because we avoid the sun at all costs. Obviously, we're sick of it pretty much. But lifestyle wise, food wise, it's like, okay, I'll tell my patients in London, we would have curry mee for breakfast, and they look at me like, I was like, yes, we do, and all 3 meals we can have curry mee, pretty much. Breakfast, lunch, dinner. Pretty much. So diet is definitely not good. Lifestyle, because of the weather, we don't walk at all. Pretty much 5 minutes.
True.
We all drive pretty much. So the awareness is definitely lacking behind compared to when I was in London, but I think it's slowly improving in my perspective.
I guess I want to ask, like, why did you guys wanted to come back, having worked in London, good lifestyle, good money? Why did you guys want to come back here, setting up in Rimbayu, and why Mind Your Spine? Is there any meaning behind the name?
Yes, great question. So yes, you're right. We have been in UK for 5 years. In London, working 5 years, but UK in general 7 years. Coming back is inevitable. We knew that even since we started working, we knew, okay, eventually we're going to come back, and we think it's the right time in terms of our experience with clinical experience, of course, with patients, but also with the techniques that we learned. So with SOT, well, personally, I have completed all 12 modules of SOT Europe, certified as well. Now that we are certified, we are confident in our level that we can actually start to share what is SOT, the true way of the understanding of SOT, and we are confident in able to help more with the community, and that's why with all ages of the community as well. So that's why, hence, with our logo, you can see pretty much a picture of a family. I hope it's a harmony family. Which, that's why we have pregnancy, pediatrics, adults, even up to geriatrics, so which up to 90, 100 years old, how old is fine. So basically all ages, and we want to bring this healing to the families, especially around Bandar Rimbayu, because we love this community in terms of the landscaping is great. New township also means a lot of young families as well, and very great potential, and we're confident that we can serve this community and actually help to solve not just any issues with their musculoskeletal, but actually improves the education in terms of how they view the body and health in general.
Mind Your Spine is basically, there's 2 meanings of it. So mind your spine, by the name of it, which means that is be careful of your spine. So just like, mind the head, mind the gap, or something like that.
Mind the gap.
So mind the gap basically is through the transport.
If you've been to London, you will
If
know.
you're in London,
If you've been to London, if you know, you know. So that's sort of like a little sign for the people to aware of your spine. And then because we're doing our technique is more SOT, so we adjust as cranial as well. So we add on in like mind to represent cranial, and then spine as in like a normal spine adjustment and all sort of stuff inside. And then in the end, we mentioned about family chiropractic. So family, obviously, is that we serve the whole family, all the community. So we see patients start from like 10 days old until even the oldest I've seen is 90 plus age, which means that we actually see all ages. So all ages actually benefits from chiropractic care. So that's why we add a family chiropractic inside to sort of like represents that it's a whole family thing. Yeah.
We also touch about, like, in chiropractic, there's a lot of different techniques, a lot of different approach. So you guys being the very first SOT certified practitioner in Malaysia, how would you explain what SOT is, CMRT, all these different things? Just tell us what your expertise is.
Yes, that's a great question. So yes, first of all, we are proud to be the first chiropractors that are got certified in sacro-occipital technique, SOT, and by SOT Europe basically. So I think yes, this technique is, I think many would have heard of it. Many would have kind of have a glimpse of what we do, just like what we are holding in our hands. This is pelvic blocks, where I think most of us, when we were in uni, in chiropractic schools, would have at least looked at it, even though we probably weren't taught how to use
properly.
Yes, probably. Just like how many with a similar misunderstanding with like activator. It is a tool, yes. It itself is also a protocol, most importantly. So sacro-occipital technique. So in the name, you have your sacro, which is your sacrum, and your occiput, which is in your head. So this exact bone, and we have many different colors so these are all different bones in our cranium that forms our cranium, actually pretty many, and all of them connect to each other through sutures. SOT is well known for cranial work, but it is much more than that. I would say cranial work is probably, if you want to give a number, maybe only 10% of what we do, because most of the adjustments are actually your spine has to be stable and your nervous system has to be adaptable before we can actually correct any cranial distortions or any corrections, basically. So SOT, again, I was a bit out of the question, because again, back to what sacrum and occiput, the connection of it is how we believe in SOT. There are coupled bones, so the bones that have coupled movement. So your sacrum and occiput, in synchronization, they should move and help out each other. And through breathing, we have our spine and sacrum should move in a certain way. Our diaphragm should also move, and I would say at the same time, our cranial also moves. So cranial bones have their own range of motion. They work together in sync, in unison with our spine, and of course the sacrum. Of course, sacrum and occiput is the most important because of where our spinal cord attaches, all the way up to our foramen magnum, C1, C2, all the way down to our S2 sacrum. So when this movement moves in the cranium, occiput in specific, to our sacrum, when they move with our breathing, it should also pump the CSF, which is your cerebrospinal fluid, in your spinal cord as well. Not just in the spinal cord, CSF actually bathes our brain and the spinal cord. And the movement, the natural movement of our breathing should help circulate this fluid all the way up, which is our whole central nervous system, basically. Brain, all the way down to a spinal cord. So why is it important is when there are any subluxations happening in your system, it would start disrupting your CSF flow, and this is what affects more than just giving you mechanically, back pain, neck pain. And when your nervous system is subluxated, of course we all know it can even impact your organs. Visceral issues can arise as well. So SOT itself, not just that it is an understanding of the human anatomy and physiology, the connection between different bones actually, and most importantly, it is a technique, a very systematic and indicator-based technique. So indicator-based means that you would have a point to check and confirm where your subluxations are after you correct, be it any way you want to correct. So it is a very free and accepting techniques that you can work with other adjusting techniques, because it only is a protocol that teaches you where the subluxations are. You can adjust it however you want, be it with a constant way, diversified way, activator, you name it. So after you remove the subluxation, you can check back the indicator. If you're doing it right, you find the right subluxation, it should reduce. Then you know you got the job done pretty much. So this indicator base is a very good tool, not just tool as in like a way for the chiropractors, especially new graduates, to really be certain on what they do and are they doing it right. And of course, most importantly, when not to adjust something as well. I think that is the most important thing, not just adjust every single thing in your body. So I would say it's a brief introduction of what SOT is.
How would you explain subluxation to people? Do you explain that with a word, or do you usually use some other word in Mandarin or whatever?
Depends, of course. Language. Malaysia, we are multilingual. So we get all sorts of patients. English, of course, I would prefer. I'm so used to doing it in practice. We get Chinese, but of course I struggle much more with the medical terms, especially chiropractic terms as well. Yes, I would sometimes need to speak Malay. Still in progress. Still practicing.
Brushing up, yeah.
But subluxation, in a layman term, I would word it less on the joints. Usually I would start with taking the spinal model and say how first our spinal joints can be misaligned in terms of not really out of place, but a joint can be stiffer and not free moving as much. And that whole area would start to have interference, not just to the nerve root, but but it's impacting the signal going up to the brain and down to your body. So your body and your brain struggles to communicate. I would say this is usually a general way of me explaining. People usually, would be a bit skeptical. Of course, it's a weird concept, but I usually show them with muscle testing, and in our practice we do some muscle testing as well to confirm subluxations, and most of the patients would actually feel like, wow, some of the, when certain positions in the body that does, highlight the subluxations, they actually couldn't, for example, control their arm muscle, and even if they want to, their bodies just struggle to control. And this is a good demonstration on, and also understand how they can start to grasp what is subluxation.
And I think another thing is, with speaking back to the muscle testing that you mentioned, it's also about how your brain and your body connects. Yes. So sometimes, yes, they do have subluxations around some certain joints or some certain area in your body. But I think for me wise, the main purpose is also to look into how your body and your brain connects. So if your brain and body is disconnected, your brain will of course wanted to perform the task, but your body just couldn't. So for example, bring back to the muscle testing that we mentioned, if you have that sort of like connection in between your brain and your body should be able to follow what your brain tells the body. So for example, we say, oh, can you hold this for me? But the brain wants to hold. If the body is disconnected, the brain wants to hold but the body can't. So they will show some weaknesses around that, which means that you can still hold, but you can feel that the whole hand probably is shaking. Yeah, so that is a signal or a sign for us to tell us that your brain and the body is not connected properly enough, that your body is not following the order from the brain.
Why would they be disconnected per se? Is it just like life stresses or like?
So for me, I always mention about three things. So first is your physical stress. Like for example, the way you sleep, the way you sit, the way you stand, are you doing any regular exercises and all sort of stuff? So that will affect how your body mobility, that will affect how your like general health. Second and third is what we call emotional and chemical stress. So emotional is when you are like in a high stress job or high stress life that will force your body into a fight and flight nervous system. So that of course will change a lot of different sort of your muscle tension, your heart rate, your breathing, what sort of muscles are you using to breathe. All that will affect and changes according to how your life is. And the third one is chemical, which is what you eat. Like just now, Tao Yang mentioned about a lot with like good food, and also yes, it's good, but like if high oily food, which means that actually your body or your organ actually takes a lot of time to digest. So that will affect how your metabolism and affects how your whole nervous system connects back, and then tell your brain, oh actually, this area we need to work more, or this area actually we have high stress. So your body will try to send more energy. So when you send more energy to your body, to your organ, then you'll feel a lot more tired on the day or like throughout that period of time. Yeah.
Yes, I would like to add on just now what you talked about, the three stresses, which I'm sure all of us would have came across in chiropractic school. So about, like you mentioned, trauma, toxins, thoughts, and especially with toxins, I'm currently certifying with the Academy of Chiropractic Nutrition, shout out, in the UK. So that has opened my horizon in terms of how many deficiency in nutrition or certain food intolerance, for example, that is creating a sustained inflammatory response in our body. That, of course, that low-grade inflammation, that is impacting how our body can heal, how quick it can heal, and also our pain tolerance, especially. Particularly with pain tolerance, pain is a very subjective thing where people perceive very differently. So, for example, some people would have extreme disc bulge, for example, and they can have literally no pain at all. Some would have very tiny bit of bulge and they have excruciating 10 out of 10 pain. So that is due to a lot of times some of this lack of certain nutrition, vitamins and minerals especially, and certain food that the body is actually rejecting, but not quite enough that people would realize, like, it wouldn't always be like a full-on allergic reaction. It can be such a low-grade inflammation that is causing all of this and various symptoms, like even eczema, even someone with, like, I'm sure all of us seen hypermobile patients, hypermobility, and of course gut issue, and of course we all know how it can impact our brain through the vagus nerve, brain development for kids, babies especially. So with this, the nutrition part is a big thing, and I hope that as chiropractors we can look more into that, because that can change how well a person can actually heal. Yes.
And then going along the lines, because you guys have been working in London, seeing different type of lifestyle, as you mentioned, what's the difference you've seen helping people in Malaysia compared to helping people in London in terms of their lifestyle, the food, the weather? How does that affect a person in terms of holding the adjustment or responding quicker?
Okay, so I found out that I think for the British, they actually do a lot of walkings. Compared to Malaysians. So yes, I understand like Malaysia weather sometimes he just doesn't want to walk. So it sort of becoming a habit that people just driving. Like even 5 minutes walks is actually like they will say no, I just rather drive. So walking is actually a very, very good exercises for like everyone, especially the elderly, because they can't do too much extreme exercises. For example, running is actually one of the very also consider extreme exercises for everyone. So for the elderly, they actually a lot of walking for them is actually quite good. So in the UK, they actually do a lot of walking. Helps their mobility, helps their joints to move better and functions better. So I will see that a lot of people here is actually not quite good with that. I think that's the biggest difference for that. How about you? What do you see any difference?
Yes, I would say there's a good point of lifestyle, which definitely is a difference in terms of people's lifestyle, not just activity levels, but also diet as well. That's why, I'm sure most of us would know, going to a Western restaurant, you have a lot of salads and everything. and technically it is kind of true when you're in overseas. Like for example, Mediterranean diet especially, they have plenty of fresh fruits, salads, and it's actually, good compared to, our Malaysian diet. But I think another thing is how we, especially in the older generation in Malaysia, how we perceive certain health conditions as a normal. So for example, even in my family itself, I'm trying to change that, of course, that hypertension is like a norm. I literally saw a patient yesterday, and I asked, of course, as a routine, I would have to ask, any health conditions you have been diagnosed?
Yes.
And he said, I have the usual 3 highs, so high blood pressure, high cholesterol, high blood sugar. The normal thing, the old man thing.
Yeah.
And I was like, yes, it's common. It shouldn't be your normal. Common and normal is completely different thing, That's what I see here, where I would say, I don't know, 7 or 8 out of 10 uncle aunties would have at least one of these 3, or if not all 3, and as a normal. And they see it as a normal. Not just that, they see it as a family hereditary thing. They're like, it runs in my family. Yes, it can be some component that can be because of genetics, but most of the time it's very little. Lifestyle is actually the biggest in terms of how you eat, and activity level.
Yes,
of course. So because of family culture, and you think that then this condition actually runs in the family. No one actually trying to break the cycle. But I do see many youngsters, young adults, they are actually starting to realize this issue, like in the family, like I don't want to have this when I get old, and actually trying to change and seeing good results. So they are breaking the family curse. So good. Everybody,
keep up the good work.
Young generation, we can break the family curse in terms of the 3 highs.
I actually want to add on about the 3 highs, right?
Yes.
So for Malaysians, they will think, first of all, it's very normal to have that 3. Like up until certain age, you normally will get that 3. This is how they are,
perceive and
yes, exactly.
thinking.
And they will very rely on medication. So they're like, okay, sometimes they even discuss, what medication you have. Like my doctor gave me this, and then I think my medication is better, you should try my medication, instead of like, they will discuss this as their normal topic. Normal conversations, normal topic. Which actually none of them discuss, what should I do to like make it lower? It's not like, they will put the medication as the first thing they will do instead of changing their lifestyle. So I think this is also one of the sort of like their mindset is very medical.
They're so outside in. They don't think the healing from the inside out.
I think that's one of the biggest, not say a problem, but like I think this is something that people need to aware and make some difference from the lifestyle to change things instead of taking more and more things into the body.
What is one thing that you like to advise them so that they can understand and actually change, or is it actually quite hard for them to change?
I think always the best advice anybody asks for, not just about health conditions they would have or any lifestyle advice, I always say listen to the body. That's not the only thing. I mean, it's the best thing you can do. When your body is having some difficulties, it tells us it in some ways through a lot of times signs and symptoms, sometimes even before that. And of course, when there are signs and symptoms, we should listen to it and ask actually why we're having this. So why my body is having this high blood pressure? It must be your body. Our body is very smart. Of course, we all know about innate intelligence. The body would do the best thing for you. It wouldn't, I'll give you this high blood pressure for fun. They are doing this to actually counter something. It's actually trying to tell you something as well. So the body is definitely not asking for more statins. That's for sure. So we have to listen to actually what our body, what is it telling us, and also how we can actually do something from the root cause, most important, the root cause, and actually change our lifestyle. And then our body would be more happy and more comfortable, basically. Yeah.
For me, probably move more. So movement is never wrong. Like the more you move actually will help, first of all, the joint health, and then of course the more you move, for me wise, I feel like it's more how do I explain that, so your brain can function a bit better. So I know someone did mention to me before, like there's never a correct posture. The next posture is always the best posture. There's no, like, any posture is never the best posture.
If you stay in it for a long time, it's going to still be an issue.
So I think that's the one of the thing I would say is keep moving.
I'd like to also touch upon perinatals and pregnancy and pediatric, because one question that we get a lot is like, babies need chiropractors too? I thought they don't have pain. So like, how would you explain to people like this, or what would you like people to understand in terms of what chiropractic can help?
So for baby wise, of course, if they have pain, they wouldn't tell you. This is the first thing. Okay, they couldn't. Yes. So to be fair, we don't look into babies' pain to get adjusted. So just like when you have a baby, you'll go to pediatrician. It's the same thing with pediatric chiropractor. So it's like a lot of mom actually brings the baby in just for general check. So what are we actually checking? So first, we are checking if there's any trauma from the birth. For example, when the baby comes out through natural birth, they have what we call as a cranial molding. Cranial molding is like, for example, this is a baby cranial. So cranial molding is when the baby is inside mommy's tummy, the bone is actually overlapping slightly so that to make the skull smaller so the baby can come out smoother. So during the first 24 hours, the cranial will try to open up by themselves. If there's any tension or any trauma through your labor, that will cause this molding, reduce this cranial molding. And then of course, like for example, when the mom put the baby on their back for a long time, if there's a tension on the back of the skull, they will cause flathead. Flathead is one of the things we will check. And then of course, we also look into, is there any like digestional problem? Is there any latching problem when the baby is out? Why is that so important? Like, a lot of people say, if the baby can't latch properly, just give like formula. But that's not the sort of like the solution of it. Why is that baby is not latching? That's the thing that we need to ask. Like, why is the baby only latching on one side but not the others? They have a tensions, or they have some subluxation, or we call it like misalignment on the C1, C2, or the first two joint of the neck. So baby spine is very unlike like adults. So adult, we have a lot of muscles to support it, but baby, they don't have it. Their muscles are very, very soft. They don't have any strength on the muscles. So the only thing they do is they will tilt the body on one side, or they will tilt the head to one side. So imagine that when your baby is tilting the head on one side, how about when they start to stand up? How about when they start to move? The whole body will start to compensate because of that joint. Worst case scenario, they might have some scoliosis after probably 10 years after or 20 years after. And then not even that. So bring back to probably the first 3 years or 2 years of life, they might cause their coordination because your eye level is different, your body compensation is different, probably flat feet because your body are trying to compensate the other subluxation. So you might not notice on that time during when your baby when they're still baby, but you will find it more and more stuff going through their life. So that's why we need to check what is going on now in order to prevent more issues going on in the future, and then to let the brain develop better. So that's also one of the things that we will check on that. We also look into their developing milestone, like at what age you should do some certain movement. For example, you should roll when about 3 to 4 months. Baby should start to sit without support about 6-7 months. Baby should start to crawl about 8-9 months. So what's going on if they skip a milestone? For example, crawling. A lot of people will say, actually it's fine, like crawling, a lot of people skip crawling, so it's fine. It's actually not true, because crawling is the first exercises that your left and right brain connects. They meet each other. Yeah. Before that, it's all left brain doing their left brain stuff and right brain doing their right brain stuff. So crawling is the first exercise that your right hand and your left leg move together. So before that, it's always same hand, same leg. Yeah. Yes. So if you don't have that crawling milestone, or I would like if you don't crawl about like 2 to 3 months, your brain is not undergo this crossing over, or like crossing over and understanding sort of like connections in between that. So you will find that the baby or the kid they will have lack of coordination in the future. So for example, they might easy trip baby, so they will run halfway and fall. So why is that so? Is because yes, probably if you skip crawling at that stage of time doesn't really make a big difference. But when they start to grow up, when they start to do a lot more complex stuff, for example, if they are running while kicking a ball, so that's even harder because they need to coordinate with their leg and coordinate with their hand and then aiming the ball. Imagine with that more complex stuff coming in, they will be harder or more difficult for them to do it, and then they will fail to do that. So that's why they're very easy to trip over, very easy to lose the game, and then actually affects their confidence, affects their personality. They're like, if I don't do good in this, then I'll just skip that. So they're probably more prone to indoor, more lack of confidence kids, and then they're more into that sort of tablets, and then the posture will affect a lot of stuff as well. So which we see that is actually everything comes from young. So that's why it's very important to get your baby to have a check to make sure that the brain development is good, and then the coordination, the body and the brain connects better, so that they can grow up better and grow up more thriving, basically.
Yes, so I would like to add on. So great introduction about pediatrics, what chiropractic can help. I think the biggest change in terms of what we can help actually with the cranium. And we talk about cranial, and kids, especially their head is very soft, any bones actually, but cranial is biggest one in the early stages of life, because of course we all know brain is in there, we all have brain in there, and how when it's soft is prone to distortions. It can be, for example, we all see flat heads on babies. We can see a shift in terms of the sphenoid bone, for example, one of the eye higher, one of the eye lower. If we detect it early, we do able to correct so that certain part of the brain wouldn't have, due to this distortion, have any delays in their development, because most of the time when the kids starts to express all this development stuff, so for example on their speech, for example on their personality movement, it can be probably 3, 4, 5 years old, and this is where if you see any delay, like my kid is not speaking to the peers, or my kid is more hyperactive, by that time most of the brain development has been done, at least 80-90%. When you correct cranial at that time, it will be we can still correct, but much slower, and the development has been done, so there's not much we can really do too much. And of course with babies as well, reflexes, primitive reflexes especially, very important to check. And I would say also about cranial, cranial would be the biggest one that we are offering, especially not too many at the moment are checking cranial enough, I would say, in Malaysia.
Pregnancy body is very slightly different. I wouldn't say very different. Slightly different from normal adults, because during pregnancy, our body will release a hormone called relaxin. So you relax everything. Like relax most of the time it affects ligaments. So at the pelvic area, we have lots of different ligaments that attach and support throughout that whole pelvic. So that ligament will all become very loose. So it will make your pelvis very unstable. Second is when your baby is getting bigger, your baby will sort of put a lot of pressure throughout your pelvis. So it makes that whole pelvic even unstable. So that's why a lot of mom having a problem with low back pain, or sometimes even press on a nerve causing a sciatica, or some terms is called pelvic girdle pain, or some of the mom having some issues on the groin is called SPD, or cholesymphysis pubis dysfunction. So all of that is due to the ligament is very loose, and plus with the baby is getting bigger. So the big contrast causing the mom is actually taking a lot more pressure. That can be helped through chiropractic care. So we can help to stabilize the whole pelvis, so that to make the whole pelvic a lot more mobile, so that to support the baby better and to stabilize the whole pelvis. So why is pelvis that important is also helping, or I would say our goal is to help not because of the pain. Our goal is to help the mom to get better labor. Why is labor so important? Because labor is the first thing that baby have throughout the trauma. So if you have a better labor, actually reduce the baby trauma and also reduce the trauma for the mom. so that we'll have a better recovery. So to help the pelvic to go back to the position a lot better. Yeah, basically that's the more like a simplified term about that. Yeah.
Yes. So at the end, I would also add on a quick introduction to what. So in SOT world, there's, besides cranial being one of the most notable, there's also visceral work, which is called the chiropractic manipulative reflex technique, so CMRT. What it works is how we want to improve the connection of not just your nervous system to your organ, but also vice versa, organ to our nervous system. Because we all know certain level of the spine does innervate to different parts, certain part of our organs as well. So by actually helping this communication, so in videos, or if you do come and shadow me, you could see normally we would poke around patient's abdomen, because that's how we can communicate with the organ directly on top of the organs. Poking here and there, that's all what you would see. So this directly helps to stimulate certain organs. So of course the goal being to improve its function as well. So not all the time would be what we need to do as chiropractors touching their organs. Sometimes it can be from the spine, like I said. Sometimes it can be through because of certain diets. Your organs are actually struggling because of your lifestyle not being the greatest, or lacking certain vitamins, minerals, of course. So we would always have a thorough examination assessment prior to so your first time being here, of course, we have to check thoroughly to be sure, okay, what is actually causing your issue. Then appropriately, then we would recommend what kind of plan of action, how we actually help to improve your health through chiropractic and SOT in general as well.
So we're coming towards the end, and what sort of resources or advice you'd like to leave to people in terms of if they want to understand more about it, or like an advice so that they can actually change their lifestyle better, or actually prompt them to actually get checked by a certified chiropractor?
Yeah, I think by this end of this show, of course, most importantly, I think we do have chiropractors watching the show, chiropractic student including, especially SOT being such a new technique in Malaysia. We are very happy to share what SOT is, and also how we can actually, we wouldn't say that we teach SOT, we're happily sharing the knowledge. And for me personally, when I started learning many years ago, theory is one thing. When you're doing it practically, it's such a complete different story. So when you have someone that I'm happily for anybody to come and shadow and actually see what SOT techniques looks like and how it actually should be performed, can be performed, can be done, indicator, etc. In terms of practically, I'm happy to help. So and happy to share as well. So probably in the future we might have a sharing session, things like that we might be doing it. Stay tuned. Yes. And for the general public, I would say the only advice, do not wait until you get any pain, if possible, of course. I mean, we all would naturally seek help when we couldn't solve anything, so be it pain, because most people, the first thing when they have pain would be taking painkillers until they feel like, oh, the painkillers doesn't work anymore, and by the time they come to us, it's usually too late. Very chronic issue that would of course lead to more damage already to certain tissues. It will take longer to heal, but also at the same time we also miss the best window in terms of help your body to heal as well, because we do have many cases where the damage is too intense that probably they are too late to actually have conservative chiropractic care. There are options towards surgery already, so we don't want to get there, and everybody should get adjusted regularly. I mean, if they come to us, we normally would show what a wellness care actually feels like, not just like, oh, so this just not like this help keeps you not in pain, but actually how it enhances your energy level, how it helps you regulate your organs better, regulate your sleep better. Of course, we also touch on certain vitamins and minerals, supplements, etc. So all this in general helps to keep your body at its peak potential. So anybody, we see all ages in mind or spine, from babies all the way to elderlies, even 90 something years old, you see. And anybody, be it you're in pain, not in pain, are more than welcome, and come and know your body better, I would say.
I'll speak a bit for the pregnancy and pediatrics about that. So I would say there's actually a lot more stuff we need to know for pregnancy and pediatrics, other than just like, oh, if my baby's in pain, then only I bring it in, because there's a lot more complication for the babies. Like the checking is different, the adjustment is different, and the knowledge behind it is actually very different from like adult like spine and adult like nervous system. So I would say if anything that resources that you can go into probably will be ICPA. So it's International Chiropractic Pediatric Association. So they do a lot of good stuff to look into how your body works for babies, how the body works in terms for pregnant mom as well, and then how to help with to get a better health throughout your pregnancy, postpartum, and for your babies as well. So they have magazine called Pathways Wellness. So that also a good resources that they will have some of the chiropractors who write their experiences, or sometimes they will put some research on the magazines. So yeah, I think that would be a really good resources to look into in terms of looking after your own self as a mom, or as for your babies, or even that you're a dad that you want to look into for your family. Yeah,
that's a good wrap up in terms of our very first on-site podcast conversation. So thank you so much again, Mind Your Spine, Angelina and Tao Yang. We'll add all the information to their website, their contact way,
everything,
and then you can just reach out to them, ask about SOT, ask about chiropractic, and then if you're around nearby, come and shout to them. Looking forward to how you guys are going to elevate the chiropractic scene in Malaysia.
Thank you.
Thanks for having us. Thank you.
Thank you for tuning in to the Life of Being podcast. Let us know what is your one key takeaway from this episode. And if this conversation inspired you, share it with a friend who might find it helpful today. Until next time, take care of your health and take care of your being.